Now we're going to move into the President's open session report, which we're going to begin with a presentation from David Akers, the CEO of the St. Lawrence Health System, who is going to answer questions that everybody has, okay, in general about, preparedness to deal with COVID-19, but in particular in Potsdam, in the St. Lawrence, County, in that region. And, thanks to Mike Maresca and Tony for reaching out to David. And David, thank you in advance for taking the time. I imagine you're quite busy. So with that, Tony, if you have anything else you want to say in introducing David Acker, please go ahead.
Thank you, Tom, and my thanks to Mike Maresca as well, and certainly to David. We've had a long and rich history, and it's only getting longer and richer. And I know our Lewis School of Health Sciences is intimately involved with using the knowledge and the welcoming partnership for our graduate students to get their clinical experiences there. I could go on and on. I'll just end by my brief intro to you, David, by saying, stuck in my mind is about a 10 p.m. call on a Friday night. I think it was March the 13th. And we talked about you had some serious needs at the hospital in terms of engineering expertise to help you. By Monday, we had an in-place memorandum of understanding that indemnified us, and we're able to send our School of Engineering and frankly, across all of our schools, expertise to help you. And so I think if that doesn't underscore the deep partnership we have, nothing does. So with that short intro, please go ahead and let us know the health environment that our faculty, staff, and students enjoy in this region. Thank you.
Thank you. So for those of you who may not be all that familiar with St. Lawrence Health System, I'll just give you a very brief overview. So if we start with the next slide, please, Kelly. We're a health system with hospital facilities in Potsdam, Messina, and Gouverneur. We were created in 2013 when the state of New York asked us to do a turnaround of the facility in Gouverneur. And then last year, we were asked again to do a similar turnaround in Messina. Have around 2,000 employees. We are the third largest rural hospital system in the state. Canton-Potsdam, the third largest of the 52 rural hospitals in the state. We started in 2007 with about 55 full-time medical providers. And so most of our energy has been focused upon building out the depth and the breadth of physician access to provide adequate care to the North Country. We're now at right around 205 full-time providers and counting. And not to ignore the surgeons, but the most important focus that we've really had is on bringing to St. Lawrence County medical subspecialists who had never set foot here before. And so in those areas of rheumatology, endocrinology, nephrology, or neurology, that's been very, very, very important. And some that we did have before, oncology and cardiology, gastroenterology, just building them out so that we had 24/7 access availability for those services. Among the most important was the hiring of a young man about 5 years ago, an infectious disease physician who's built a really terrific infectious disease program without whom we just could not be doing what we're doing now. Next slide, please. St. Lawrence County is, of course, the largest county geographically in the state. You can see Gouverneur and Messina and the distances that we're dealing with in terms of trying to fight this COVID problem. We're the only trauma center between Plattsburgh and Syracuse. We have a number of educational programs that we host, the most important being the Clarkson PA program. And we also, about 5 years ago, created a clinical research department, which has really been an important component of what we're doing. And we're hoping that next week there'll be a public announcement that St. Lawrence will be the first rural facility that will be doing a trial on a very promising COVID drug. Next, please. When Tony, right at the time that Tony and I were talking that Friday night, we realized that we had to quickly act in order to get in front of the COVID wave that was coming. We recognized that neither of the smaller hospitals were really equipped to deal with any meaningful COVID impact. And so what we did in those facilities was simply created isolation spaces so that when patients coming to their emergency rooms came in COVID suspicious, that they would be isolated and then they'd be brought to Potsdam. We wanted all COVID care in this county to occur at the main facility. Next, please. In order to ensure that those COVID people coming to this facility did not infect the entire facility, we had to act very, very, very quickly. This diagram shows the 4 floors of the main hospital here. You'll note in the bottom right-hand corner, there's letters EDRU. That stands for the ED respiratory unit. So what happens when these ambulances come in, they are not, those patients are not going to our emergency room. They are being sent to the COVID ED, where we treat those patients for anywhere between an hour and a half and 5 hours. On average, we have about 20% of the patients go to the COVID inpatient unit. About 20% of those patients will go to one of the floors, and about 20% of those, 60% of those patients will be discharged. On the second floor, you'll see what's called the APU. That's the Airborne Precaution Unit. That's our inpatient COVID unit. We wanted to make sure that the rest of the hospital, especially the third floor, was clean. We have usually about 2 to 4 people in our ICU proper that are ventilated, and we did not want those already compromised patients to be commingled whatsoever with COVID patients. Similarly, that floor is where we have the maternity ward, and we have the surgical and medical inpatient wards, and we needed to make sure that those areas were clean. So if a patient comes into the EDRU, they are brought to the APU, that need admission, they are brought to the APU where they stay until they're ready for discharge. We spent a lot of time in making sure that people that work there, they come in different exits, they do not wander in the hospital, food's delivered there, the nurses are doing the blood draws. There's virtually no traffic in these areas. They have separate entrances and exits into the parking lots of the facility. Next, please. And the 4th floor, by the way, was our surgical floor. About a third of that was devoted to the OR. 2/3 was our ambulatory surgery unit. We needed to convert that as well, so to negative pressure, and convert it to a med-surg floor to take on whatever surge came out of the airborne precaution unit. I think we only ever surged beyond the airborne precaution unit's 20 beds up there, but that's important. On all these areas that you've seen retrofitted, whether it's the EDRU, the APU, or the 4th floor, we could not have done this without the tremendous assistance of Clarkson in helping us get the negative pressure units on, to do the air balancing. It was a very, very complicated and tricky coordination of events that had to happen quickly. And fortunately, because of that partnership, by the time our first COVID unit person came, they came to our ER respiratory unit and they went to our APU. So they never went into the ED, to our knowledge, nor did they ever get on one of our patient floors. What you're seeing is the design that was fabricated, I believe, in about 36 hours with Clarkson's help. That's our ED respiratory unit. Next, please. Everyone has been hearing around the country about the desperate situation that all providers are dealing with personal protective equipment. The most important part of personal protective equipment is really the N95 masks. These are the masks that are used now in all of the clean areas. And there was a finite supply. There were no deliveries coming. We became familiar with the University of Nebraska study on how one could potentially sterilize N95 masks for reuse. And we came to find out that there were not just one type of N95 mask, but there were a whole variety of them. Some of them lent themselves much more to breaking down, whether it was the mask itself or the straps would erode. They'd be sterilized, but they would be unusable. And so we needed to have the Clarkson faculty engage with us in perfecting this, trying different times, distances for the mask, intensity of the UV light, and finally, for those masks that we just couldn't, find a way to get the process through without breaking the snaps on them, they created an engineered device that allows us to not worry really about the straps, only the masks. Next, please. This is the highest level of protection is what's called a positive air pressure respirator. And what you see here is one of the Clarkson University floors. You see Dr. Jemison and our infectious disease PA, Kylie Brohall. She's by way of Clarkson PA grad. We had several of these PAPRs that were modern. The problem with them was that they needed to be recharged every 8 hours, and we didn't have many of them. What we did have is a significant number of hazmat PAPRs, like the ones you see on the left there around Kylie. They're heavy, they're bulky, they had single-use batteries that lasted only 12 hours. Most of the batteries were out of date. And the problem was that we couldn't really keep our employees safe in either the ED COVID unit or the inpatient COVID unit without having 24/7 PAPRs. Now, she's not in what we call the moon suit, but this is the important part of the respirator. As you can see, it's bulky. So what Clarkson was able to do was able to rewire the circuitry, change the battery modalities so that now we have adequate capacity so that we can run 24/7 in both the ED COVID unit and the inpatient COVID unit. It was a game changer, absolutely. Next slide, please. We are operating under a incident command infrastructure. We have been since March. That means that we're using our pandemic emergency incident control system. Every morning we meet at 9 o'clock. We meet every day at 4:30. We track everything. This is just one example of, there's a cluster we hear, there's a home for the disabled, Messina. They're positive. We want to know where they are, and working with the Department of Health, trace them, see where the clusters are, see where the travel is. Next, please. We engaged in a study that really may not have been thought of by New York as the way to go, but we decided to do it anyway. We were finding it was difficult to get swabs for the normal swab test. And so there's a serology test, it's an antibody test, that is not as reliable as the swabs for detection of a person that's currently positive, but does have a fairly high reliability in telling you if a person's had it. And so we took patients from our primary care practices, we allocated them between the 42 zip codes that populate the county, and then we broke them into cohorts of age groups and an equal amount male to female. We then decided we would have the amount of the tests that were deployed to a particular zip code based upon that population's relationship to the whole of St. Lawrence County is 112,000 people. So Potsdam, for example, got 72 tests. Canton may have gotten 50. Star Lake got 4. And what we found after completing these, that there were only 3 patients who had tested positive, and they had all had, they expressed that they had within 4 to 5 weeks prior to this study that just finished in May, early May, that they had mild flu-like symptoms that had resolved in mild flu-like times. So that was very, very encouraging to us. Next, please. We also have had a priority on screening, both the public as well as our employees. We had been screening our employees, but we felt we needed to do a full 2,000 employee screening. Through yesterday, we had 1,000 of those tested, and we have had no positive tested. We're going to complete the other 1,000 next week, and then we'll go back and do a high-risk area random screening process that we'll be working on consistently as this goes forward. Next, please. As you all are aware, the North Country is one of the few regions in the state that was permitted to go into phase 1 reopening. We're fortunate to be able to do that. As you can see, I want to give you some comparisons. So our population here, we've tested a little over 5% of the population. This does not include serology tests. Had 192 positives. Had 2 fatalities back in, one in March and one in April. The state average for positive test percentage is about 26%. Those areas outside of the city, 22%. So at St. Lawrence County, we're 3.5%. I think that's going to continue to go down if we can continue to do what to manage it correctly. Finally, next slide, please. Here's the priorities for this organization going forward. We have to maintain the vigilance that allowed us to get to these sort of markers where you have no employees positive. You have 3 people out of 550 that are positive. We need to make sure that we increase the testing of the employees as well as the residents. And we begun implementing reopening pilots in clinics, surgery, and outpatient areas. So if you, for example, would have 10 primary care physicians who are seeing 20 patients a day, we want 2 primary care physicians who will see 10 patients a day to start. And slowly ramp that up, making sure that we don't have people in waiting room, that they're being called from the parking lot, taking all of those precautions to make sure that as we reopen, we are confident that we are safely caring for the patients. We have 4 different lab analyzers that are capable of point of care testing. We have no reagents to allow for that testing. We don't believe that there's going to be any coming our way in May. We do believe that by the end of June, there will be, and that will be critical. As Tony mentioned, our organization's existence and survival is integrally intertwined with Clarkson's and the other universities in the county. And so we are prepared to work as fully or as limitedly as any particular facility or university would like. We see there's a way for us to play a potentially large role in helping bring back the students with a feeling of security. And lastly, I think that it's going to be very, very important as we continue to do what we're doing and demonstrate that one can go to work safely. One can have a productive educational experience. One can enjoy life normally with precautions. There will be no safety or security until the vaccine comes, but we do believe that we can demonstrate on a relative scale that we're a very, very safe environment if we remain vigilant and continue to do the things that we're doing. So with that, Tony, I'll open it up for any questions or comments that anyone may have.